Good afternoon, everybody.
Hi.
Oh, yeah.
Hello.
Hi.
Hi.
Hi, everyone.
Hello.
Hello. Hi.
Right.
As people are joining, if you can do the same as last week and put your names and your organisations in the chat box to say hello, that'd be lovely. It's also a way of us actually having a register of who's attended, so that at the end of the 3 masterclasses, we're able then to send out some sort of recognition of attendance. So.
Afternoon.
Good afternoon. See, we're all a bit brighter today because of the glorious weather outside.
Yeah, it is lovely. Nice to get it at last.
Yes, it is. It's lovely. It feels like, makes it feel like hope is on the horizon.
Yes, definitely.
Okay, we'll just give people another couple of minutes in case we've got some more that are late in joining us. I keep threatening every time I do something on Zoom, I say to myself, I'm going to sort out something so I can play music as people are arriving. And then it goes straight out of my head until I do the next Zoom call. And I think, oh, I still haven't sorted it out. So I think my ambition for these masterclasses, apart from learning quite a lot, will be to make sure that before we finish, at some point when you join one of them, or the support networks, there'll be music at the beginning, okay?
What music would you play though, Karen?
Oh, it needs to be something, some world music or something. I used to do it for events quite often because it just changed the atmosphere in the room as people are arriving. So, you can hold me to account for that, okay?
Okay.
Before the end, I will have sorted out some music. So.
It won't be Simply the Best or anything like that, or We Are Champions or anything like that, will it?
No. I always used to try and play something that most people hadn't heard of, so I didn't cause any offence anyway. And I used to use it as well to try and change the mood within the room. I remember doing something on when we were doing some work on developing a resource for positive approaches to reduce restrictive practices. So I was changing the music to try and change the way I wanted people to work in the room. So it was good. It sort of makes it a bit more entertaining for me as well. So, okay, so anybody else that's joined us in the last 5 or 10 minutes, if you can say hello, put your name in the chat box, that'd be great. Just so that we can actually sort of use that for our register of attendance.
If you can pop your centre name beside your own name, that would be good as well.
Okay, is that everybody from the waiting room, Steph?
Oh, sorry, I was muted. We've got one more joining. But yeah, that's it now.
Okay, so just to recap on a few ground rules from last week. So it's a welcome to everybody. Glad that you've been able to come back today. We've got a really interesting session that Madeline is going to be leading today, and I think you're going to get an awful lot out of it, or I hope you're going to get a lot out of it. So we're going to do exactly the same as last week. Madeline will go through the presentation. We'll stop at 2 o'clock for a half-hour break, and she'll give you an activity to do while you're having your cup of tea. And then we'll come back, and Madeline will continue with the presentation, and we'll stop at 3:10, so there's some time for questions and answers, and then Madeline will outline what's going to happen in the next session. Use the chat box for questions, and we'll try and gather those together as we did last time and go through as many as we can at the end of the session, in between 3:10 and 3:30. But if we don't get through them all, or if there are things that occur to you in between the masterclasses, don't worry, because we've got another opportunity to come back and look at this unit when we do the support network meetings. Just a reminder that whilst Madelata is presenting, if everybody can go on mute, please, and turn your cameras off. We're fine for the minute, but once Madelata starts presenting, if you can turn your cameras off, then it's just less of a distraction, so that can be really helpful. The session is being recorded, and we will make them all available on the Health and Care Learning World's website, along with any of the supportive materials that are being used. And then just if you having difficulties with connection today, you probably know by now, sometimes it helps to log out and come back in again, or to make sure you've got any VPN or apps turned off that are going in the background. So again, today we've got Susie with us.
Hi everybody, welcome back. Susie Gray here from City and Guilds. And
Steph, who would have been sending out the invites, etc. to you.
Hi everyone.
And I'm going to hand you over to Madelata now. So welcome back, everybody.
Hello, welcome back to this second masterclass, which is on Unit 411, Theoretical Frameworks for Leadership and Management in Health and Social Care. I apologise in advance. There are a lot of slides this time around, but my thinking was that this masterclass is going to be recorded and people can refer back to those slides. So as they call it, Death by PowerPoint, yes, that is definitely this today. But I'm hoping that you can use this as a resource to look back on and use the slides, and that it will help you in terms of your future work, in terms of taking this unit and the qualification forward. So what we will be doing today is I'll give a brief overview of the unit. Also, we'll look at one of the presentations that's currently uploaded on the website, and also I'll go through the assessments. So in terms of this unit, there are 6 learning outcomes in total. So theoretical approaches of leadership, management and innovation and change, a learning outcome in relation to legislative and regulatory frameworks, one in relation to evidence and the measurement of outcomes, using concerns and complaints to improve practice, managing innovation and change, and how to use coaching, mentoring, and motivational interviewing. As a reminder, guidance for the learning content and assessments for Unit 411 is available in the Level 4 assessment pack. There's also information in the qualification handbook, as well as the learner student guide. So there's 3 areas of guidance that are very helpful in terms of informing your knowledge about this unit and how you can best support learners and students. So some of the key messages that I want to put across in terms of the assessment and this unit was that the experience of the pilot level 4 award in terms of this assessment was, it was a very sort of hands-on assessment task in that it led to students influence innovation, and by that I mean change for improvement in their organisations, as many of their proposals for change went on to be implemented. And this really boosted students' confidence, because there they were actually making a positive difference to the settings in which they worked. And this task and this unit, I really feel that it just made such a tremendous contribution to their confidence and their sense of achievement. And in a sense, what it did is it put them into the shoes of a leader or a manager, because it made them think in ways as a leader and manager would, in terms of what is it about the work that we need to do to change things. The other thing is that in terms of the tasks, and I'll talk more about them, it could be, as was the case on the pilot award, that a lot of the learners and students had never written a report or delivered a formal presentation. We had a really broad profile of students, and my guess is that that trend will continue. So what we had was, we had sitting alongside each other students, for example, who had, some of them had master's degrees, but obviously what they needed to do was get the qualifications that would enable them to become practitioners in health and social care. And they would then be sitting alongside students. I can remember one student clearly, and she was a student who had left school at the age of 16, hadn't studied academically for about 40 years. So you've got a really broad range of academic backgrounds in terms of learners and students that come on the course. So for example, for the latter example that I gave, in terms of the student who had left school, not done any academic study for 40 years, then being required to write a report and deliver a presentation, it just instilled a great sense of fear. But after that student had delivered their presentation, it instilled a great sense of pride and confidence. And one of my memories from pilot was sitting there watching presentations and just feeling absolutely proud and amazed by what these students, who quite a few of them lacked confidence, stood up there. And you know, some of them were really nervous, but it was just an amazing experience. And I would say that that's one of the great rewards that you will go on to experience in terms of this unit, seeing learners and students grow and develop. The other thing then about this particular unit and these assessment tasks is that on the pilot level 4 award, many students consulted their manager on their proposed change to practice. And that was really good, because that then brought those students into a different relationship with their manager, where they were working alongside each other as partners to discuss proposed changes to practice. And one of the things to remember is that level 4 is preparation for level 5. And so that element of collaboration between a learner or a student and their manager is going to be really essential. So what level 4 can be about is sowing those seeds, developing a really lovely foundation then for that learner or student to have a different sort of relationship with their manager. And even though they might have a separate mentor as well, it is almost the start of that shadowing mentoring experience, whereby, for example, some managers suggested a proposed change because it was felt that it was needed, or that student as an employee would say to their manager, look, can I have a look at this because I've observed perhaps that this could do with improving. So that, I would say, is very important sort of strengths in terms of this particular unit and these tasks, in the sense of what the learners and students are doing is they are developing their skills in terms of writing a report, delivering a presentation, gathering evidence, which I'll go into, but also developing their confidence as future leaders and managers. So what I would say as well, before going on to talk in detail about this particular unit, is when approaching a learning outcome across all of the units, the PowerPoint presentations that you can download on the Health and Care Learning website is a really good starting point. And it's suggested that a learner or student is introduced to this presentation first. And that's because this presentation sets the scene, and it contains definitions that provide an understanding about the topic before further exploration. So what I'm going to do is I'm going to share with you a couple of slides from the first learning outcome for this particular unit. So the learning outcome is understand theoretical approaches of leadership, management, innovation and change. And I'll show you some slides because, in a sense, the slides that I'll show you are indicative of the sort of format that those presentations follow, and hopefully you can find them useful in terms of, as I say, being a starting point and setting the scene. One of the things that I would stress is that these PowerPoint presentations that are on the website, they are literally a starting point. So they're not sufficient in themselves. They will have to be blended with other content and other research that needs to be carried out by the learner or student. So, for example, obviously I haven't copied all of the slides in, but mention is made in this particular presentation of Bridges model, and it might be that you say to the learner or the student, go onto the internet, find out a bit more in terms about Bridges transition model on the internet. I do know, for example, that in that presentation, I also make reference to Cotter's model of change, but that is available in Learning Outcome 5. So it is to stress that those PowerPoint presentations, and I'll show you a couple of slides now, are not sufficient in themselves, but they are a really useful starting point. Okay, so for example, as I say, this is in relation to Learning Outcome 1. in this particular unit. So Introduction to Theories and Models of Leadership, Management, Innovation and Change, just to say where you see, and you might see this on a few slides. So for example, on this particular slide, you can see PE1 SO57, just ignore that. That is nothing to do with this current qualification. So there's nothing to worry about in terms of that. So as you can see, and this, as I say, sets the trend for the other PowerPoint presentations. So what you've got there is it's saying, for the purpose of this unit, we will use the following definitions. And so what I've included there is a definition for leadership. And so at least then there's a common starting point in terms of a definition of leadership, because as we well know, there are, well, I would hate to guess how many definitions of leadership there are, but there are probably hundreds of different definitions of leadership. And so it is useful for learners and students to have some sort of clear point of reference in terms of what is meant, for example, by leadership and what is meant, for example, by management. Often as well, what you'll find is those PowerPoint presentations will contain questions, because in terms of the pilot award, many of these PowerPoint presentations that have been uploaded, quite a few of them were actually used in class. So when we were using them in class, for example, this question would have been posed. So we would have got people to work in groups. Having said that, quite a few of the PowerPoints were uploaded for students to work on them on their own. So they were used for two purposes. Some were used in class, but some were also used for students to use those PowerPoints independently. But those PowerPoints, they are useful because they do draw out perhaps some key questions in terms of what are you trying to find out? What are you trying to get at? And so here, what we've got is, why do we need to lead and manage innovation and change in social care and health? And if anyone's wondering why the order was social care and health, is because this award was, as a pilot, was originally developed for Social Care Wales. Nothing more than that, really. And the questions are good because they get students and learners to think, okay, I know I'm learning this, but why am I learning this? What am I trying to get to the bottom of? So that's why how the PowerPoints can be used. If you look through the PowerPoints, you'll see quite a few key questions, and I think they can be very useful whether you're working with a group of learners and students or whether you're working individually. I think they can work equally well to try and get to the nub of an issue, to try and get to the bottom of why are we trying to find something out? Why is this important? So we're learning about innovation and change. So what? Why are we learning about it? And these questions can sort of tease that out, start to get thoughts developing. So in class or whether individually, they are supportive in the sense of the question is asked and it's followed by answers. So what we've got here is we've got some examples of answers in terms of that we need to make sure that our responses are contemporary. They're not based on what individuals wanted in the past. They're based on what individuals want in the here and now. We all know this, we're constantly having to do more with less. And so part of innovation is there isn't going to be any magic sky of resources. So what are we going to do? How are we going to do things well with the limited resources that we've got. We can also then tie it back to needing to comply with relevant legislation and policy in different ways. And we can also ask the question, you know, there is a saying, if you do the same thing, you get the same results. If the same results aren't actually what you want, well, in that case, why not try something different? And also, for example, another response is that no size fits all. And so there is, if we're talking about, for example, person-centered ways of working, it is that thing about respecting individuality and uniqueness. So that's how, just to sort of give you some insight, those PowerPoint presentations can be useful, because what they do is they provide definitions, they provide key questions, and they provide some suggested responses. And so that's why they can be a really useful starting point in terms of having those initial discussions with a learner or student at the start of a unit. And similarly, what you'll find with those PowerPoints is often they draw out, for example, key theories or key legislation. Okay, so that's that bit. What I'm now going to do is move on to this specific unit, Unit 411, and I'm initially going to talk about the assessments involved in this particular unit, which relate to development of a report and a presentation. Some things to remember, and obviously all of this guidance is in the assessment pack. The learner or student must not be handed the assessment tasks until they've completed all of their learning for this unit. If they're given the assessment tasks before they've completed their learning, unfortunately, they'd be really shortchanged, because right up to the end of the final learning unit, they need all of that learning behind them to support them to complete their tasks effectively. So the two elements to this particular task, this particular unit, are task D, and there's two parts to it. So one is they have to produce a report that outlines a change to practice. And two is that they have to deliver a formal presentation, propose the change to practice, which is approximately 15 minutes, followed by a discussion with their assessor of 5 to 10 minutes. And to bear in mind that these tasks will be externally assessed by the awarding body. What you will be sent after this masterclass is a copy of this PowerPoint presentation and also an information sheet. And in that information sheet is some guidance in terms of how learners and students can be supported to develop this report and presentation. The information sheet relates to the potential formative assessment tasks and ways in which you can support that learner or student to really become skilled in what they need to become skilled in terms of developing the report. When discussing proposed changes to practice with the learner or the student, it's really important to encourage them to be realistic about their proposal and not go too big. So we're not talking about major organizational restructure or anything like that. We're talking about small changes that can actually make a massive difference. So there is a need to encourage that learner or student to not go too big and be realistic about their proposed change. And what I would say is, because that happened on the pilot, that's why so many of those changes got to be implemented, because they were manageable and they were realistic and their value could be seen. And so as a result of that, they went on to be implemented, which was fantastic. One of the key points to be aware of is that if a learner or student is struggling for ideas, Care Inspectorate Wales produces inspection reports, and they're available on their website, and they include recommendations for improvement. So that's a really good source of ideas. And again, the joy of that is that those recommendations for improvement are grounded in reality. Those, for example, if they get their inspiration for one of those from Care Inspectorate Wales, from one of those inspection reports, if they get their inspiration from there, that's brilliant, because basically that has come from reality. It's come as a result of an inspection taking place in a care setting, and the inspector saying, this, we're recommending that you improve this practice to improve outcomes for individuals. The other thing to note then is that there's real encouragement to use resources such as these, and also to encourage the learner or student to be proactive in this area of development. So what you want the learner or the student to do is to be a leader in this task. So you can point them to the resources, but ideally, well, definitely, I would say, you want the idea to come from them. And what I would say is that I think that on the Pilot Award, one of the reasons that this task worked so well was because the students owned it. They had the idea, they had the enthusiasm for it. They could see that by implementing the change, it could make a difference to their practice and to outcomes for the individuals with whom they worked. And that's why it went so well. So I would say that as tutors and centres, you're there really to point them to the resources, but what you want is for that inspiration and that energy to come from them. In terms of the order of things, it's suggested that the learner or the student writes the report first, and after it's written and they're happy with it, then they prepare for their presentation. The reason for this is because essentially the learner's or student's presentation is a summary of the main points of their report. Having said that, it is important to remember that by this stage, by the time the student has written their report, the tutor can't give any feedback, because once you've given the learner or the student the task of writing their report and delivering their presentation, they have entered the assessment process. But what you can do before that assessment process starts, before they enter it, is to make it clear that the presentation is in effect a summary of the main points of their report. Because if we think about, for example, if we say, for example, when I was in a committee meeting, delivering my report, presenting my report in front of the management committee that I was accountable to, what you would do is you would have distributed the report first, and then your presentation is about drawing out the key points, the key messages. And so that's what you're expecting the learner and student to do in this. So as I say, once they've started that task of writing the report, that's really their area of responsibility. You've handed over to them, but you can make it clear at the formative stage and when they're working through their learning outcomes, is that presentation is in effect a summary of their report. One of the things, a critical aspect of the presentation and the report, is that it meets the key requirements of the assessment. So for example, in the presentation, you'd expect that presentation would present a clear rationale for the proposed change, and it would relate this to either, and I'm going to come into more detail on this, but for example, one of the key requirements is that they relate their proposed change to practice, either to the Health and Care Standards Framework or the Regulation and Inspection of Social Care Wales Act 2016. So what I've got there, in case you're missing the links, it's the change must relate, oh, hang on a minute, sorry. The change must relate to a relevant theme or principle. So it would be one of the 7 themes or principles in the Health and Care Standards Framework, or it would be one of the regulations in the Regulation and Inspection of Social Care Wales Act, such as the statutory guidance. And I've included the links there so that when you get the PowerPoint presentation sent to you, you'll have the links there. Okay, so in terms of the report and presentation structure, I would suggest that the learner or student can develop their report and presentation structure as a formative learning task. So my suggestion is that you encourage the learner or student to develop a template. And as I say, after this masterclass, you'll be sent an information sheet. And what that information sheet contains is an example of a report template. And that's just a suggestion to get you thinking in terms of how can you best support your learners and students to develop a report template or a presentation template. On the pilot, we found that having that template really helped, because especially once you start doing your research, it's very easy to lose your way. So if you start with a template and that's there, at least then the learner or the student can keep returning to it, and they can keep thinking, right, why am I doing this research? Why am I finding this out? Yes, I remember it's this part is going to feed into, for example, my introduction, or this part is going to feed into my application of a model of change. So what I would suggest learners and students might find helpful, based on the experience of our students, is that having that report template and that presentation template in advance, so that it's a structure, can really help the learner and student to focus and to be quite systematic then in terms of the work they're doing and the way in which they're contributing towards their report and their presentation. Okay, so evidence is really, well, across all 3 units, it's really important. But equally in this unit, a critical requirement of Task D is that the learner or student must link their proposed change to practice to a change management theory, regulatory framework, theories, statistics, and other influences. Now, when you get the information sheet, the report template is just a suggested report template. It provides a concrete example of a proposed change to practice, which relates to reviewing personal plans. So by the end of this masterclass, what you'll have is you'll have 2 concrete examples of proposed changes to practice and how you then take a model of change and apply it to that proposed change to practice. So that's one example, which relates to personal plans, and it will make sense when you see the information sheet. And also now, what I'm going to do is start talking you through another example. It is quite detailed, but as I say, what I felt was that you can then use this recording and you can go back on it and you can look at certain aspects of it to sort of inform your future work when you're supporting learners and students. Okay, so the proposed change to practice that I'm going to talk you through is to offer my proposed change to practice, and I'm going to let you know where it came from as well. So what I did, and this is what I'm suggesting you do as well, is I went on the Care Inspectorate Wales website and I had a look through some of the inspection reports. And one of the inspection reports that I came across related to the inspection of a care home for older people. And I looked at the recommendations for improvement, and the recommendation for improvement was basically that the care home, let's see, because I wrote it down. Yes, so the recommendation for improvement that was in that inspection report was to ensure that meal choices promote 5 portions of fruit and vegetables. So this proposed change to practice that I'm providing to you as an example, as I said earlier, it comes from reality. It comes from a recommendation for improvement that can be found on the Care Inspectorate website, and it comes as a recommendation for improvement from a care home for older people. So what I'm hoping you'll be able to see by me talking you through this example is how basically learners and students can be supported to take their proposed change to practice and really support it with a strong foundation of evidence. And what I'm going to do now is talk you through those different aspects of evidence, and also talk you through aspects that are a requirement of this particular assessment task. So, as was said in the assessment guidance, one of the requirements is that your proposed change to practice should link to one of the two regulatory frameworks. So just to remind ourselves, what I'm going to talk you through, my proposed change to practice is to offer an increased number of healthy snacks to older individuals living at Skiee care home. So the link then to a regulatory framework, what I then did was looked at the regulatory framework, which is part 7, the Regulation and Inspection of Social Care Wales Act. And I could see that in terms of where that recommendation for the improvement to practice came from, there is Regulation 21, Standards of Care and Support, overarching requirements, and the guidance within that regulation is individuals are supported to maintain a healthy diet and fluid intake. And the key thing then in terms of the guidance is healthy choices of food are available and promoted. So now you can see this is just the start now of where the magic happens, because what you'll be doing in terms of supporting the learner or student is, because I think this happens all of the time, it's just a fact of life that we're all so busy with the practice and getting on and delivering services that we very rarely have time to reflect and think. And that's the whole point really of qualifications and reflective practice, is to say, right, take a break, have a think, reflect. So on the face of it, you can see what's starting to happen is you're encouraging a learner or a student to be thinking at 2 levels, because what you've got is, on the face of it, you've got something very practical here. The practice is offering an increased range of healthy snacks. So that's the practice. The doing is offering an increased range of healthy snacks. So there's the practice. But now what you're doing is you're saying to a learner or a student, but why is this important? So this is so why are we doing this? And this is now, as I'm talking you through this example, where those links are made then between the doing and the thinking and the values and the other influences that lead to this proposed change to practice. So here you can see at the very start what a learner or student can do is they can see that here's a practice that, and then they're going to propose a change to practice, but there's a direct link there because they can link it to a regulatory framework. So that's, and again, this is where you're really strengthening their ability to think of themselves as a future leader and manager. Because as a leader and manager, if you're proposing changes to practice, there would be an expectation that you can provide a clear rationale in terms of why you're proposing it. And one very strong aspects of rationale is that you can, it's a regulatory requirement or it's a recommendation that's come out of the regulatory framework, and you're promoting good practice. So there you go. That's what we're going to be focusing on. We're going to be focusing on the proposed change to practice. And there's the first link, which is the link to the regulatory framework. And you've even got it narrowed down to Regulation 21, and the specific guidance of healthy choices of food are available and promoted. Okay, so now what we're doing is what I've put up on the screen for you there is applying a model of change. Now, I've used Lewin's model of change because I personally speaking, I like it because I find it's straightforward to use, and I understand it, which is always a really important thing. But the learner or student can use a different model. So I'm just using this as an example of a model of change that I've used, but there's nothing to stop the learner or the student to use a different model. And also it could be that for me, because of the proposed change to practice that I've got here today, for me, it could be that Lewin's model works well, but it could be that depending on the learners or students' proposed change to practice, they might feel like, well, actually, no, I think, you know, this particular model works better for me. So I've used Lewin's, but there's nothing to say that the learner or student can't use a different model. And in the guidance, what it says in terms of this assessment is that the learner or student must use at least one model, so that they don't have to use Lewin, it could be a different one. So what I've done here then is just summarized where I feel this particular proposed change to practice fits in, and I'll go into some more details. I've got some bullet points to follow on this. So for me, in terms of Lewin's model of change, Lewin talks about unfreezing. So what is the motivation to change? That's what Lewin says is unfreezing is about identifying what needs to change really and why. So in that box, there's some key things that jump out, which is that the majority of snacks at the moment are not healthy snacks. They don't promote a healthy diet, and in fact they can increase risks in terms of, for example, obesity, some diseases, and poor oral health. So then in terms of Lewin's model, you've got step two, which is changing what needs to be changed. So what I've got here is that there needs to be an increased number of healthy snacks to be offered to increase individuals' voice and control. So at the end of the day, it will still be down to those individuals to choose. So obviously what you're not saying is, you know, we're going to get rid of all of our unhealthy snacks and only have the healthy snacks, because that would be wrong. But the point is, at the moment, what is happening is that there are no healthy snacks to choose because there are only unhealthy snacks on offer. So the proposed change is that, for example, if it was, I don't know, having a cup of tea in the afternoon, what you would be faced with is an ability to make a choice of whether you would want snacks that are traditionally classed as unhealthy, or you make a choice of maybe some snacks that are healthy, or you mix the two. But that's the point, is that ultimately the individuals retain that voice and control, but they now have voice and control to make healthy choices, because there are a wider range of snacks available to them, and that they can then promote their well-being and reduce their risks of poor outcomes. Then, in terms of applying Lewin's model of change, what I talked about there is refreezing. So Lewin says the refreezing stage in terms of the model is to make the change permanent. So what would make the change permanent is that the healthy snacks are offered every day as an integral part of Skiee Care Home's food and drinks provision. So that would make the change permanent. So hopefully you can see what you've done there is you've taken a model of change. As I say, it doesn't have to be this model of change. And again, what you've done is you've applied it to this particular proposed change to practice. And what you can see is 3 clear steps. Now, as I say, I know I said this last week, so it's just to stress, you might be looking at this and thinking, well, Modelato, I wouldn't have put that in that box. I would have put it in that box. That's absolutely fine. You know, I'm not sort of giving you these suggestions as something that you absolutely have to do, but I'm hoping that what it will be helpful in terms of informing your thinking and how your centre wants to develop, or how you as a tutor wants to develop, and how you can use these different tools to support your learners and students effectively. Okay, so as I say, what you've got then, I've just put some examples of some key points, and I think what I'm going to do, I'm going to cover these next 2 slides, and then we'll take a break because I don't want to lose the thread of thought. So, because these link directly to Lewin's model of change. So I'll just go through this slide and the next one, and then we'll take a break. So remember, we've got these 3 stages of Lewin's model. And what I've done now, and again, this is what you can perhaps encourage your learner or student to do to help them structure their thoughts and to help them structure their thinking, is to think, well, okay, what are the key points that I want to make in my report and in my presentation? What aspects of this change are important and why? So if we stick with Lewin's model, what we've got is number 1 on the unfreezing and the becoming motivated to change. And as I put in the box, that the majority of snacks currently offered are high in fat, salt and sugar. So for example, it could be that at the moment, what is sort of put on offer is cakes and biscuits. And I'm not saying all of a sudden those cakes and biscuits disappear, because if that was me, I'd be absolutely heartbroken. It's not about that. It's about increasing choice so that individuals can then increase their choice. So part of the aspect of unfreezing then is that at the moment, what is missing is there's a lack of healthy snacks on offer that contain fruit and vegetables. As I said, this then doesn't promote a healthy diet or support well-being, because it increases risks of obesity, some diseases, poor oral health, which then leads to poor outcomes for individuals. In terms of the unfreezing, in terms of focusing our thoughts as to what are the drivers to this change? What has motivated us to think about why we need to make this change? Well, actually, one of the reasons is that it's a proposed change to practice that links to an area for improvement identified by Care Inspectorate Wales. Now, the recommendation in the report was to ensure that menu choices promote 5 portions of fruit and vegetables a day. And so it just made sense. It was logical that consultation, why not? If we're making changes to menus for meals, why not consult on making changes to the snacks at the same time? Okay, so obviously what is inherent to working practices is, in terms of the unfreezing and becoming motivated to change, is consultation with individuals and those significant to them, such as, for example, family members, about proposed changes to the snacks and menus for meals and reasons why. So this can become part of the unfreezing stage. And then as regards changing what needs to be changed, again, and you can see what's going on in terms of these key points is that learners and students are being sort of involved then in different aspects of good practice. So, for example, co-production is an essential part of the Social Services and Wellbeing Act and good practice. And so in terms of these key points, one of the key points is the importance of consultation. So that is where this proposed change to practice, you've got that main change to practice, but at the same time, you're drawing in other aspects of practice that are expected to be there, such as consultation with individuals and those important to them. So what you've got here is in the changing what needs to be changed, for that process to be effective, consultation with individuals, inviting suggestions for additional healthy snacks, research into healthy snacks that are appealing and will meet needs for hydration and nutrition. So what you're weaving into here is what needs to happen, what needs to take place to move from one situation to another. And then in terms of the refreezing, how are we going to make this change permanent? So for it to work, for it to happen, for it to be a success, obviously what you want is support from individuals who understand the rationale for the change. It's all about, and we say it time and time again, don't we? It's not about doing to, it's about doing with. So this is about a journey that you make together. And similarly, support from staff who understand the rationale for change. So it's about having a shared commitment, contribution to suggestions, and it could be that, say, for example, you decide you're going to go to create a recipe book with contributions from individuals and staff. So this refreezing is really what you're doing is you're saying, what does our new future look like? You know, if we imagine this change to practice is a reality, what does it look like? So what we're saying is, well, the way that it looks, our future change, it looks that individuals are on board with it, they understand it, they're happy with it, and they want to go with it. Similarly, staff are on board with it, and they've embedded it in as part of their work, and they understand why the change is needed. Similarly, you know, very practical things like shopping orders reflect the revised menus for snacks and the meals. And again, as I say, what you've got is you've got this overarching change to practice, the proposed change to practice. But But sitting underneath that then is other areas of good practice. So good practice is never that you just implement a change. You actually want to see how in reality is that change working. So monitoring of feedback from individuals and those significant to them, such as family and friends, for example, monitoring of feedback from staff. But what's happening on the ground? So for example, if the healthy snacks are the ones always left over, what is that telling you in terms of the proposed change to practice and what needs to happen as a result? And any change is subject to ongoing review, because it's like any new idea or any sort of practice, until it becomes a reality, you really don't know how it's going to go. So, you know, it could be further changes based on feedback, observations and experience, and regular rotation of snack ranges. And again, that could be that what you're finding is that some healthy snacks are more popular than others. And then you get an understanding of why, in terms, and also that thing of you don't want it to be boring. And so you think about things like promoting choices and nutritional value. And I think that is a good point at which to stop, because what I've done there is I've talked you through applying a change model to the proposed change to practice. And so when we come back after the break, I can start talking you through other forms of evidence that can be used. Now, during the break, what I'd suggest is that you go on to the Care Inspectorate Wales website. It's on the, from memory, if you look at the website, I just need to, bear with me a minute. Oh, I know what it is. A minute. Okay, so what I suggest, go on the Care Inspectorate Wales website and just have a little look through the inspection reports that refer to health and social care settings. A lot of those reports do contain recommendations for improvement. And when you go on the website, where it is, it's to the right of the website, and you'll see a tab that says browse our directory of registered care services. And then you can search via the service type. Service type. So that was the notes I was looking for, is where it is on the website. So that's my suggestion for your activity during the break, is go on to the Care Inspectorate Wales website. It's to the right of the website, and you'll see the tab, and it says browse our directory of registered care services. And then you can search for via service type and just have a quick look through some of those reports, and you'll see that quite a few of them have got recommendations for improvement. And so that's it from me for now, until we come back after the break. Shall I hand back to you, Karen?
Lovely, thanks, Matilata. Okay, so do you still want us back at 2:30 because we're a tiny bit over, or do you want to give people an extra 5 minutes?
Extra 5 is fine, because I think we're fine for time.
Okay, so back at 2:35, we've got a number of questions that have come through, so we will make a note of those. I've made a note of them, and we'll come back to them then when we finish the presentation from Matilata after the break. Okay, have a good break, everybody.
Okay. do you want me to make a start?
Yes, please, that'd be lovely. Thank you, Moderator.
Okay. Welcome back after the break, everybody. I hope that you had a chance to go on to the Care Inspectorate Wales website and drew some inspiration from some of the pages and inspection reports. I'm going to continue this presentation, and I'll make sure that I've finished by 3:10. So we just left Lewin's model behind. And so what we'd done was we'd related the proposed change to practice of offering an increased number of healthy snacks to older individuals living at Skiee Care Home. We'd made the link between the proposed change to practice and a relevant framework, and we'd also applied Lewin's model of change. What I'm now going to do is give you some examples of other evidence that you can use to support your proposed change to practice. And then obviously these suggestions that I'm showing to you, you can pass on then in terms of guidance and support for your learners and students. So as I say, this should be grounded in reality, this proposed change to practice. And one of the learning outcomes in this unit is responding to concerns and complaints. So examples of relevant organisational feedback that might underpin the proposed change to practice can be publicity material, annual reports, as I've already said, the Care Inspectorate Wales inspection reports and recommendations for improvement. It can also be informal and formal feedback, such as compliments, concerns and complaints, and obviously confidentiality will have to be adhered to, and observations. Now, one of the things that I'm conscious of is that the learner or student will be employed, paid or unpaid, or have access to a placement within the health and social care sector. But my guess is that in terms of the feedback to the organisation that they can obtain, it could vary. But I think what needs to happen in that case is that they can still, for example, take from publicity material or annual reports, or if there was a challenge in terms of getting organisational feedback, for example, feedback from individuals accessing experience in the service, that needs to, any challenges that are had in terms of putting this report together, that would then have to be communicated in the report. That would be my suggestion. But in a sense, what I would say to you is, you can see here in my proposed change to practice, I've developed this based on a fictional name of a care home. And you'll see as I go through the different types of evidence, it wouldn't be the end of the world if, for example, the learner or student couldn't get direct access to concerns or complaints, because there are lots of other sources of evidence that can be used. Okay, so I would say one of the biggest roles that you have as tutors and as centres is to support a learner or student to become a really good researcher, as this is a skill that they'll need for their career as a leader and a manager. So, for example, when legislation or guidance changes, they'll know where to look and how to implement change. So what I've highlighted on this page, and this has all been accessed via the internet, examples of relevant research that links diet to well-being in older people. So that's why I say one of the the biggest sort of forms of support is that thing of giving a learner or a student skills to become an independent and effective learner and an independent and effective researcher, because that's what they're going to need for their future. So it is things such as, for example, using appropriate search terms so that you get what you want. So I've just cited a couple of examples here in terms of a useful website page that I found from the British Nutrition Foundation in terms of linking diet to the well-being in older people. And a really good piece of guidance that I found was Welsh Government guidance and on food and nutrition in care homes for older people. That's, you know, if you click on that link, it's a really good report and really relevant to this proposed change to practice. And then examples of relevant statistics. Well, again, this is all research done on the website. So if I were pulling this report together to sort of, because really what you're doing is you are looking for evidence that enables you to make a really good, strong, convincing argument for why your change to practice should be implemented. So that's why I say, for example, the reports that the examples of relevant research, those two examples there, there's some really good, strong grounds in terms of basically what they're saying is if you have good food and nutrition as an older person, it promotes well-being and reduces risks. Similarly, here's some relevant statistics. The fact that, for example, 1 in 4 people in care homes have diabetes, and that was research that is reported by Diabetes UK. So the other thing is as well, is that in terms of encouraging or supporting learners and students to be good researchers, is to know where to look for research findings that you can trust. So, you know, for example, not going on, say, chat forums, go to well-respected organizations and well-respected sources of research. And again, here I've got a relevant statistic from Public Health Wales that 60% of adults in Wales are overweight or obese. So one of your rationales could be that being overweight or obese in Wales is a problem for a large percentage of the population, and therefore your proposed change to practice is supporting a reversal of the tide and a reversal and a reduction of risks in terms of to individuals within Skiee care home. Other sources of evidence, if you like, to support your argument as to why your proposed change to practice should be implemented. And again, these resources are there within the unit and they're within the PowerPoint presentations. So examples of relevant theories, there's Brooker's theory of person-centered care. And this theory is promoting that there should be absolute value for human life, regardless of age or cognitive ability. And this is a commitment at Skiee care home. The point to make from, for example, theories of functionalism, conflict theory, and organizational and ethical leadership. And I think this is a really good and strong thinking point for learners and students, is that if we live in our own homes, we take it for granted that we exert choices over virtually everything that we do. For example, meals that we eat and snacks that we eat. And then, for example, if we then move from our own home into a place like Skiee care home, then it is reminding learners and students that we don't realize it perhaps, but then we lose control, for example, over meals and snacks, because yes, there will be a choice, for example, in terms of menus and snacks, but it won't be the same as, for example, pulling together our own shopping list. And a very powerful learning point really from this proposed change to practice is to think about who has control. And as a result, who has control and how should that control be used? And it should be used ethically, and it should be used in a way that shares power with others. So those theories can give the learner or the student a really good opportunity to, again, communicate their understanding of where power and control lies and how that power and control should be used in the right way. Similarly, again, something that is within the learning materials, it's in the first unit. Again, this stresses why these units should be learned in sequential order, because you're always building upon knowledge as you go along. And that's the biopsychosocial model. So the rationale then can be that good practice is to promote a holistic approach to well-being. And so offering healthy snacks is linked to biological well-being, but it also promotes psychological and social well-being, such as someone being empowered to make positive choices and to be able to make healthy choices. And also, for example, if the snacks are linked to social events. So that's an example for you there of how you can use relevant theories to add punch or add weight to your argument as to why your proposed change to practice should become a reality. Then if we turn to codes and legislation, we can link this proposed change to reflect professional practice and behaviours required from leaders, managers and staff working in care homes. So for example, in Social Care Wales Code of Professional Practice for Social Care, Section 3 states, you must promote the well-being, voice and control of individuals and carers while supporting them to stay safe. The other thing is that this proposed change supports physical well-being as defined by the National Outcomes Framework for the Social Services and Wellbeing Act, and the fact that the physical and mental health and well-being definition or statement is I am healthy and active and do things to keep myself healthy. And so hopefully what you can see going on is that this proposed change to practice has a number of really strong anchors to it in terms of evidence coming from different directions and different sources to provide weight to an argument as to why that change to practice should happen. And again, you know, strong argument here in terms of the fact that the proposed change also reflects the fundamental principles of the Social Services and Wellbeing Act. And so, for example, in terms of voice and control, individuals and those significant to them, such as family and friends, are involved in the decision making relating to what they eat and to improving outcomes. In terms of prevention and early intervention, the fact that access to healthy snacks reduces risks. Also, co-production. This is a great example of co-production in terms of the change that there will be the links there in terms of working together and consulting. And then in terms of well-being, this proposed change to practice will increase well-being. So it is a proposed change to practice that can promote health, well-being and resilience. There is then, in terms of the proposed change to practice, a section that relates to any potential challenges to implementation. And so here, what you might want to explore is what are the potential challenges to making the change permanent or refreezing? Could it be, for example, gaining the commitment of staff or individuals? It could be, if we concentrate on staff, that staff are resistant to change in the belief that individuals are happy as they are, or that individuals won't like the changes. So potential ways to overcome the challenges can include reference to approaches such as coaching and motivational interviewing, and those PowerPoint presentations are available to talk as part of the learning materials. Okay, so that concludes reference to this example, and hopefully what you've been able to see is the diverse forms of evidence that will then strengthen that rationale for a change to practice that intends to improve outcomes for individuals accessing and experiencing health and social care services. And I hope that what I've shown is that by identifying a proposed change to practice that is realistic and manageable, it makes it a lot easier then to locate relevant sources of evidence. And also in terms of the fact that, as I said earlier at the start, that a lot of these proposed changes to practices on the pilot award were actually implemented. And it was because they were fairly small, manageable, but they made a big difference. So what I'm now going to do is just conclude with a summary of Task D, Part 1 and 2. So just as a reminder, and as I say, the guidance is there, some key points is that it has to be a clear rationale for the proposed change to practice, including its likely impact on individuals within the setting and outcomes, including the influence of feedback, such as compliments, concerns, and complaints. The change has to be appropriately linked to the Health and Care Standards Framework or the Regulation and Inspection of Social Care Wales. And also, the learner or student has to refer to relevant sources of evidence, and I've talked you through those different examples just now. Within the guidance, it also says that there has to be evidence of clear knowledge and understanding of at least 2 change management theories. At least 1 change management theory has to be applied to the proposed change to practice. And you saw me do that with Lewin's model of change. Potential challenges to the change have to be identified, including how they might be overcome, which is why I identified potential challenges and identified ways in which they might be overcome. Also, The presentation should be within the stated time requirement, which is approximately 15 minutes, and it should be clear, focused, and well reasoned. And the subsequent discussion should also be within the stated time requirement, which is 5 to 10 minutes. And this too should be supported by well-reasoned responses to discussion points and questions. Okay, so that concludes this masterclass, and I hope that you have found that useful as a real working example.
Thank you, Maddalata. Okay, so I'm going to pick up on a couple of questions. I made a note as people have been logging them. So I'm just going to pick up on a couple of those, and I invite Maddalata and Susie to help me with some of the responses. So the first question, there are two I'm going to join together. The one is about, with Task D, it's about proposing and not implementing an area of change. That's correct. I think what we were talking about early on as part of the pilot, a step up to management, and then the subsequent rollout of it across Wales, is even though it was only a proposal for change that people needed to do, very often they actually implemented that change as well. So even though that wasn't required, lots of students went ahead and actually implemented that change. So it's not a requirement for the qualification attainment, but people do go on and do it, or very often will go on and do it. And I guess there's another question then, which was about examples of positive changes. So when Maddalata was doing the first part of the presentation, I went through some of the testimonies that managers made about the impact of learning on students who'd undertaken step up to management, and some of those actually talked about some of the change projects. It wasn't a question they were asked, this was what people had said. So some examples of change that people proposed and then implemented, because that's what the managers were talking about, was somebody actually introduced the use of memory books with older people. As a result of that, they became part of the Swansea Life Story project, developed a life memory book template and guidance, and then that was used not only for their service, but it was actually rolled out across the local health board and the local authority. Another person looked at alternative daytime opportunities to increase the community presence and develop the social skills and valued participant in society for a group of individuals. Another person looked at improving the input of young people into their care plans. There was another one where there was a care home, and the student reflected on the fact that there were some people living there that didn't have any families, so they didn't have their family outings at all or go out of the setting. This person actually developed a cinema sort of setting type club in the basement, and people living in the care home were given membership cards, and there were dedicated cinema nights, and it was used for match days then as well. Somebody else looked at improving the medication policy and the use of medication within a setting. Somebody looked at how the induction framework, the AWIF, was implemented and introduced competency-based assessments. And somebody else set up a men's group for accessing community activities. So those are some real life examples of what people actually put into place. They didn't need to, they needed to do the proposal for it, but these are things that people actually did. So I hope that's helpful. Maddalata, I don't know if you've got any other examples that come to mind from the many presentations you saw.
Yeah, it is to agree with Karen that definitely the task is a proposal, but it is to say that is why it's such a fantastic task, because a lot of these proposals did go on then to be implemented. One that I remember distinctly was where a student worked in an organisation with individuals who live with a learning disability, and they changed their recruitment practice. So their proposal was to involve individuals in the recruitment process, starting with advertising, and that then went on to be adopted as it was actually then implemented as a change to practice. And I remember that really stands out for me because it's just so powerful in terms of promoting co-production, and also that whole thing about voice and control in terms of individuals being a real pivotal voice in the recruitment process.
Okay, Vicky's just come through with another question, Susie. I was just going to check quickly, but I wasn't quick enough off the mark in looking at the assessment strategy for level 5. So if you can just clarify that before I say something that's incorrect.
Never. Okay, so the level 4 and level 5 qualifications are related. And as you all know, for the most part, learners will need to have the level 4 qualification unless they hold the stepping up to management qualification. So there is a connection. The difference between the assessment approach is that within the level 4, you are speculating around an area of change, whereas within the level 5, you have to gain approval and implement that area of change. So I don't think that it would be appropriate for you to expect learners to be able to bring their proposals straight in unchanged from the level 4 to the level 5, but it would certainly provide them with a really solid starting point. Remember that when they come through their level 5 journey, their knowledge and understanding and insight will have grown and extended and been enriched substantially from where they were with level 4, and therefore they and you will need to take account of that. So certainly it would be worth having those conversations and thinking about the level of integration between level 4 and level 5. But it's really important for that level 5 journey to be distinctive and to give the learner the opportunity to showcase that stretch that they've experienced by completing their level 5.
Yeah.
So I hope that helps.
And I have just double checked, so I was right in what I was going to say. But you know, when you doubt yourself. So at level 4, we're talking about a change in practice. So it's a proposal for a change in practice. At level 5, the focus is on a change to the provision or the service delivery. So it is that step up again. So if, you know, there is a distinction between the change that you're looking for at level 4 and level 5. I did remember that from when we were looking at the assessment, but I just wanted to double check that was correct. So it's worth probably you all just going back into the assessment task for level 4 and level 5 and having a reread of those, because you can see there's a change in language in relation to what's being asked for that as a piece of work. Okay, there was another one which was as part of formative assessment, can they complete, I think they should have said trial, not trail, trial changes, report presentation, i.e. a mock.
I responded to that in the chat directly to the writer of that query, but just for other folk who are present with us today. And really it goes back to that whole thing that we've just talked about around that this is a preparing process. And so, you know, there are a number of different things that Madelata has suggested through the course of today to try and build that skill set and to make sure that learners are best placed to have success through their assessment process. So it is about preparation, it's about giving them the tools without veering too closely to what the external assessment is going to ask them to do. So you do need to sort of tread with caution so that you're not giving the game away and compromising that assessment process, but definitely preparation through formative assessment and looking at some of the suggestions that Madelata have shared with you today would be really worthwhile doing.
Thanks, Susie. Okay, we've got
I
another
also
one.
think things like formative tasks can be, because I know that some students were petrified at the thought of the presentation. So a formative task could be, you know, just encouraging them to practice their presentation skills, even if it's not with the tutor, just so that they've got that, they know that they've got that confidence and they've got the skills that they need for when they deliver their presentation relating to their proposed change to practice.
Absolutely, Magdalena, and it can be about anything that, you know, they can be looking at stuff that is familiar to them, but again, you could be giving them tasks that are completely unrelated, you know, just to give them that practice, and to help them feel what it's like to be having to showcase their insight and their knowledge in a very small pocket of time. Because there isn't, you know, flexibility for them to go on and on and on. It has to be within a set piece of time. So those are the things that you do need to sort of bear in mind in your preparation. So it's preparation in terms of knowledge and understanding, but also preparation in terms of exam technique, if you want to call it that, or assessment technique.
Lovely. Kathy, you've got a question for us. Instead of me reading it out, would you like to speak it out loud?
Yeah, I was just wondering what the duration was. You know, how much time did you allow for completing the report and the presentations? Because we're just looking at developing timelines at the moment. It would be really useful to find out if you had, you know, whether it was sort of it met expectations, or it was a bit shorter, or you needed to give them a bit longer, just to give us an idea of how long to allocate for this task.
Okay, our approach on the pilot was slightly different to the assessment as it is at the moment. So on the pilot, the way that we approached it was that the student had their template, and then they would work on a different aspect of their template every week. So for example, they would spend, say, 1 week developing the introduction. Another week they might develop, you know, some of their key points. So the approach that we used was that they would be, and it was the same actually across the 3 units, what we encouraged our students to do, because they had such varied academic backgrounds. And so especially for those students who maybe, you know, as I said earlier, had left school 40 years ago, hadn't really done anything since. So we would get them to be working on their formative tasks, if you like, incrementally. So in terms of your timeline, if you wanted to go along with what we were doing, I'd probably be distributing, for example, the report writing task across those 6 learning outcomes. So it is a very long timeline and a very gradual development of skills and building up the writing of that report.
Okay, can I just say something that's probably going to go contrary to what you've just said there, Magdalena? Sorry, guys, it's really, really important that you follow what the guidance is that's outlined in the assessment pack for this task. I think we've been quite clear throughout that this is a sequential process. So, and you will need to do a readiness for assessment process when you have delivered the learning for this unit. You know, so that will inform your process. So once you've released the task associated with this unit, we are not supportive of a drip, drip, drip backwards and forwards. This is external assessment. You know, so you have to release the task to the learner, having confidence first that they are at that point where they're ready for that assessment, and then it is for the learner to work through that task sequentially and to be sufficiently confident in their knowledge and understanding to know how that task aligns with the unit that they have just completed, what you will do then as assessors is you will agree the submission window for that task. And there will be other things that you need to think about as well in the context of liaison with other individuals associated with the assessment journey. So it's really important that you think about those things. So it's very different to the experience of Magdalena's learners. So you just need to be really conscious of that when you are preparing for this task and the end of this unit.
I guess,
I would
Susie,
agree.
there's a lot
Sorry.
there in relation to the preparation, though, isn't there? And preparing people for that final task.
Yes.
In
terms of formative assessment, yeah.
In actually, getting them to think about it as they're actually moving through the learning. So, that's really important, that they actually are being mindful of what it is they're going to need to be able to do as they're actually undertaking some of the learning.
So there's a delicate balance here. If it was all assessments through controlled conditions, then you would have a lot more flexibility, but it isn't. And so you really do need to be very careful that you're not encroaching on, whilst you're developing that skill set, you're not encroaching on the landscape that is the external assessment bit, and it's going to be a really, really fine balance. So you do need to develop their report writing, you do need to develop their research skills, you do need to make sure that they understand all of the different types of things that are within the unit themselves, but you also need to give them the scope to complete the assessment independently.
Yeah, absolutely.
I agree with that. And I would definitely stress, you must all listen to Susie, because I am the ghost of Christmas past. So it's massively essential to listen to Susie and what she's saying. What I feel is that you've got those 6 learning outcomes, and that's the point at time, because remember, the assessment task can't be released until the unit is completed, the learning on the unit is completed. So bearing in mind, you've got those 6 learning outcomes, so that is the time at which the formative task can be done, the preparation tasks can be done. In preparation then for, as Susie says, that is the clear cutoff. Once that assessment task gets released, that's when you let go and they go ahead. But hopefully by then, because you've been, because I remember I said this in the last week, if you sort of develop that timetable of learning content, formative tasks, prior to releasing the task D in this situation, then your learner or student should be, feel ready to go then.
Thanks, Marzalotta. Vicky, you've got a question for us.
Yeah, just wondering about the external assessor and whether that's allocated per centre, and when we'll find out who that will be.
It's a really good question, Vicky, and if I had an answer for you, I would share it with you. It depends on volume.
Okay.
So if we are inundated all at once, then we will have to deploy our resources in a very creative way. Whereas if we've only got 1 or 2 individuals coming through, then it may well be that the same external assessor is allocated to those 2 individuals, whether they're in one centre or different centres. So it does depend on volumes, which is why I've been asking you all to share your insights around that, so that we can think about how we're going to deploy our resources and do that in a logical way.
Okay, thank you.
And we've got another one, Susie. Once the task is released, how much time would you allow before submission?
That is something that we resisted doing, Karen, if you remember. We did have a window of expectation initially written in, but then that was discussed and debated at length through the submission process, and then it was taken out. So you do, there is a table in the assessment pack. You can recreate something similar to that table at your own discretion, but there is an expectation that you will sit down as an assessor with the learner and agree that submission window. Now, of course, your learner will have pressures in their world that will come to bear on that, but you will also have pressures in your world that you will need to consider. So, it's something that you cannot do in isolation. You must be talking to your internal colleagues, your internal quality assurer, and you need to be thinking about how best to manage the process. And then on top of that, you will need to think about things like resits and resubmissions, and how you're going to manage that side of things. So we have set in the assessment pack the duration of the actual assessment, where we have some expectations around that, but when you release the task is when the learner is finished the learning and you are confident that they're ready for assessment, and then you negotiate with the learner and other internal colleagues around how long you get them to get ready or submit that assessment, depending on what type of assessment it is. And then you will follow then any protocols that are in the assessment pack. So it will vary from assessment task to assessment task largely, but you will need to think about a number of different levers there to arrive at a point, and then you'll need to think about whether learner A's experience is the same as learner B's experience, and if it's not the same, why is it not the same? And that will be part of your internal quality assurance, and certainly part of the lens that the external quality assurer would look at.
Thanks, Susie. Kimberly, you've got a question for us?
Hi, I was just wondering, are the learners able to do further independent learning after the tasks have been given? Because we're using a Moodle system to do a lot of our learning, so we wouldn't really be able to prevent them from continuing to learn after we've given them the tasks.
Okay, so this is where you might have a slight issue then, Kimberly, because you need to make a readiness for assessment decision. So you'll need to have something in your system that allows you to do that, and then if a learner does go back in and undertake further learning, then that could be seen as revision, but it is the tasks that are internally assessed are set under control conditions, so you'll need to have systems in place that will allow you to protect the validity of that process. So it's the Barks process, things like plagiarism, that sort of stuff. So an issue around the controlled side of things, and of course you'll learn when they go into the external assessment process, will be in a room with their external assessor, either online in a virtual room or in fact it will always be a virtual room, so they won't be able to have access to your online processes in that context. So you need to sort of think about how you're going to integrate your systems to the process that you need to put in place for these qualifications.
Thank you.
I think there was a couple of questions earlier about things like, it was to do with duration as well. I'm trying to just scroll back here. It was to do with learning, I think. I can't find the question now, but the answer is that qualification has got an expectation of guided learning hours. I think there was a question around self-directed study. I can't find it in the chat now, but it was definitely something around, do we see things like talk classes? Oh, here we go. It was from Sean. Sean, if you're still in the room, do you want to share that question with the rest of the group?
Yeah, I was just wondering, we've got lots of resources on our system that the assessor's going through with the learner, but would you prefer, is the preference for a more of a classroom-based learning experience for the learner, or is this one-to-one learning and self-directed learning. Is that okay?
Okay, so there is a very clear definition about what is meant by guided learning hours, and each of the units in the qualification handbook, there is a reference to the guided learning hours for each unit. And guided learning is supervised learning, so that doesn't necessarily mean in a classroom, but it certainly does mean under the direction of your tutor or your assessor. And so certainly you can set the learner some things to do that they go off and do. But you know, you do need to manage that as an assessor. So I'm afraid that this particular program probably does not lend itself at all well to the concept of distance learning in its truest sense. So you may well have to think about that, Sian, then, in terms of how you corral your resources and make sure that you are looking at the guided learning expectations of each of the units.
As a pilot, it was delivered as a blended learning program. So there was a combination of the student learning independently, but also coming together in the classroom.
Does that help at all, Sian?
Yeah, really helpful. Thank you.
Trying to see if there's any other questions that we've missed, Karen. We could open up to the floor and see if anybody does have an outstanding question that we haven't got to. If you want to pop your hands up.
No, we're okay.
Doesn't seem to be any.
Okay, I'm just going to post something. But as I was looking through for some examples of the changes people have put in place, first of all, I started looking at the evaluation report from the initial pilot we did, which I think was 2015-ish, something like that. So there's just one quote in there, which is from one of the learners that undertook the programme. So I'm just going to post that for you to finish off, because I know I waxed lyrical about the impact it had. But I just think we got some lovely quotes from people, so I'm just going to post that for you to see. This is from somebody who had been working as a care and support worker and then undertook the very first cohort that we took through for Step to Management. So I just think it's quite a nice quote to sum up our session today.
Very powerful, isn't it?
Okay, so we'll get the presentation sent out to you, and we are just finalising next week's after this this session today. So we will try and make sure we get the invite will go out to you from Steph again. Thank you all very much for your contributions and staying with us. See you all next week.
Thank you.
Bye, everybody.
Bye.
Bye, everybody.
Bye all.
Thank you. Bye.